Dr. Corina McMahon has extensive experience treating children affected by serious illnesses, focusing mainly on sickle cell disease. She believes in the power of the Barretstown programme and is always impressed with the feedback from children and families following a trip to Barretstown.
From a family point of view, generally speaking, it might only be one family unit who would go down, but then they would be going down to a situation where there are other families, not necessarily sickle families, but other families. So they can again take time out in a holiday environment, and they can all engage in stuff that they'd never do at home. And by engaging in stuff that you never do at home, then it's a real break. And I've noticed that when families come back, they are more chilled and less wound up and easier to deal with the troubles that life brings, because they've had that time out, that little space where they can just relax and enjoy themselves. When the children come back from Barretstown, the things that we would notice, it is like having a break. So they're full of life, full of jizz, and full of fun, extremely happy when they come back. And also over time, you do notice that they are maybe a little bit more independent. They can stand on their own 2 feet, they can talk for themselves. But actually the children, because they're in an environment where, yes, they have independence, but there's always somebody looking after them, even though they don't necessarily recognise it, that they do have gain that independence, which they will need for the rest of their life. So they are learning life skills in how to be independent, how to look after themselves. Any child who's gone down has always wanted to go back. They've always said, when can we next go back to Barretstown? Because it is such a great place for them. And I would fully endorse sending the children to Barretstown, and I'd fully endorse families to go, because you won't know what you're missing until you've been there.